Hi everybody, Darren Reeves here, President of DP Distribution and Consulting, here for another DP Minute. Did you guys know that when they wrote the actual draft of the QMSR back about 2 years ago, they published it for us to comment, us being industry. And when they just published the final rule back in February, it has what they call the preamble. And we've talked about this and we're going to continue to talk about it. So in that preamble, there are 83 different comments that the FDA answers. We're going to be going over not all of them, but many of them and what their thought process was. So just in a second here, we're going to read to you exactly what the FDA said the categories were for those comments. Basically what they said is some comments raise concerns or request clarification regarding the effective date of the rulemaking. Well, we now know what that is. The scope of the rulemaking, we'll talk about that more later. The FDA's proposed definitions as well as specific defined terms in the proposed rule. That's causing a lot of problems right now. Record-keeping requirements, implementation including the process for inspections conducted after the effective date. What they're talking about there is what's going to be the replacement for QSIT, the Quality System Inspection Technique. We still don't know the answer to that one, and they're being pretty close-lipped on what they're going to come up with. So we'll stay tuned for more on that one. And then they're also talking about the implementation of certifications to ISO 13485, which means they're not going to give ISO 13485 certification, and they're not going to accept your current ISO 13485 certification either. So that's something that we'll see how that transpires down the road, and then also traceability requirements. So those are the categories of the comments that we're going to talk about over the next several weeks, and you're probably already seeing a lot of people out there doing a tremendous job of putting this in writing. We're doing this specifically for those visual learners like myself, but also you can't get too much of this too early. We need to start talking about it and clarifying these things now. So that's your DP Minute. We'll see you next time.